Okay, guys, I'm here to take you through the nursing care plan. So, how to go about the nursing care plan. So, as you can see, this is the front page of the nursing care plan. So, there's the front page. And if you're able to fill the front page correctly, you have 6 marks. The middle page is 12 marks. So, that's why I told you this place entails a lot. So, 12 marks. Okay, so let's dive straight into how to go about your nursing care plan. Now, the front page is very easy. You get all the details from the patient and from the patient's folder. From the patient and from the patient's folder. Okay, so if this was your exam, you write your index number here. So your index number will be there. Now, these are information you get from the patient's folder. So patient's name, let's say Mr. Michael. Okay. An inpatient number. Okay. In the hospital, they have these numbers they assign to the patient. It could be the insurance number, etc. But they have a number they assign to the patient. So let's say 2857 and maybe 21. Let's say the patient was admitted in 2021, so something like that. Then the age of the patient. So let's say Mr. Michael here is 30 years, and Mr. Michael obviously, okay, is a male, so male. Okay. And occupation, what job is Mr. Michael doing? Okay, so let's say he's a mechanic. Okay. Now the physician or the surgeon, at this part, you write the doctor taking care of this patient. Okay, it's mostly in the patient's folder. Okay, so, and also with the physician, sometimes it's not just one physician, it's a team. Let's say when you've ever been to CAT, Confanochi Teaching Hospital, you realize that they don't come in isolation, the physician. They come as a team, maybe medical team A, medical team B, surgical team A, surgical team B, etc. So let's say this physician here is a soloist. So let's say Dr. Akwesi is taking care of Mr. Michael also. Now, date of admission is always found in the folder. So, and also in the nurse's note. So, maybe let's say 12th of April 2021. Now let's move on to this part. This part. Okay, so we have ward. So what ward is Mr. Michael also in? So it could be a medical unit or a surgical unit. Okay, so let's go with medical. Medical. Okay, and the bed number. Every patient has a bed number. So let's say bed 3. Okay. The religion, you can ask this information from Mr. Wusu, and he will gladly tell you. So let's say Mr. Wusu here is a Christian. And the diagnosis, it's always in the folder. It's always in the folder. Okay. And if you are not quite acquainted with the medical term, whenever you see a triangle, it represents a diagnosis. So let's say the doctor won't just write the full diagnosis here. You just draw a triangle. It's the same thing. It's referring to the diagnosis. So let's say Mr. Owusu here is diagnosed with jaundice. And maybe it's a multiple diagnosis. Okay, so jaundice and let's say hepatomegaly. Okay, now operation. If Mr. Osu here has undergone any surgical operation, you write the type of operation he did. Okay, but if there is no operation, you just write not yet done, not yet done. So let's say Mr. Michael has been to the surgical unit and had this operation. So we just write the type of operation that he did, and all this information can be obtained from the folder. Okay, so let's say Mr. Owusu here hasn't been to the surgical unit for any operation, or the theater for any operation. So you just write not yet done. Now, date of discharge, we are still in the ward with Mr. Owusu, so we just write not yet because he hasn't been discharged. Okay, so not yet. Okay, now let's move on to these parts. So gradually we are making progress. Okay, patient problems. So at this point, this is what the patient tells you, the complaints of the patient, and what you as a nurse observed. So here we have the objective data and the subjective data. The subjective data is just the information the patient will give to you, and the objective data is what you as a nurse can obtain through measurements, observation, etc. Okay, so let's say patient problems. Mr. Owusu can tell you what's wrong with him. So let's move on to what Mr. Owusu said. So patient, and this is how you write it though. Patient complains of pain in the abdomen. Okay, that's the first one. Patient complains of sleepless nights. So I have two subjective data from the patient. So the next thing I'm going to do is to add my own objective data so that you know how we write these different scenarios when it comes to writing the patient problems. So patient complains of pain in the abdomen, patient complains of sleepless nights. Okay, my own objective data. Patient is anxious. The next one, patient has inadequate knowledge about disease condition. Okay, so these are the patient problems. The first two are subjective data obtained from the patient. The next two are objective data obtained from my own observation and some measurements. Okay, now let's probe further into the patient problem. You see, I wrote pain in the abdomen first, followed by sleepless nights, followed by anxious, followed by inadequate knowledge about disease condition. Okay, so this is it. You don't just write patient problems. It has to be stated in order of importance, in order of relevance, in order of severity. So the most severe ones comes first. And when it comes to pain is the most severe of everything, of every patient complaints. Aside, let's say the patient is not breathing, that one is an emergency. Please, I hope you are following. So pain comes first, followed by sleepless nights, followed by anxiety, and followed by inadequate knowledge. Mostly knowledge and education is the last thing to do for the patient. Knowledge and education, they are the last thing to do for the patient. Okay, so we talk about pain first, then let's say sleepless nights. Let's say the patient also complained of hot body or fever. So fever will be next and before sleepless nights. It has to be in that order. Degree of severity. How severe is the patient problem? Okay, so here you can write with a pencil. Then after everything, you arrange them according to order of severity. Just as I said, if the patient is not breathing, it's an emergency and it has to come first. So that's the patient problem. I cannot breathe. Are you following? So we just have to solve your breathing problem before moving on to your pain. Do you get me? Because if you can't breathe right now, you will die. But if you're in pain, I think you can hold on a little bit. I don't know if you get the scenario. So mostly pain comes first because obviously the patient might be breathing. So maybe the pain should come first. Then you arrange them according to how severe you find the problems. Okay. Now let's move on to allergies. Let's say the patient is allergic to certain food stuff, etc. So you write the type of food stuff the patient is allergic to. Let's say granite paste, beans, etc. So here, Mr. Owusu has no allergy. So you write no known allergies. No known allergies. Okay. Now let's move on to patient strength. Patient strength. Okay. Now you write the patient strength in relation to the patient's problems. So you write it in relation to the patient's problems. Okay. So now let's see what we wrote here for the patient problem. The first one. Patient complains of pain in the abdomen. Now the patient strength is basically what the patient can do to help his or her condition, or what the patient has to help with the recovery. Okay, so now let's move on. Patient complains of pain in the abdomen. So what can the patient do in these trying times of pain? Okay, now this is what the patient can do. Patient can tell the severity of the pain and its location. So this is what the patient can do to help with his recovery, or to help him recover. Okay. The second one, patient complains of sleepless nights. Now what can we do, or what can the patient do, or what does the patient have to help with this problem? Okay, now the patient might have told you something. Maybe I can sleep well when the lights are out. So let's say he gave you that information. So you write patient can sleep well when the lights are out. Okay. Now the third one, patient is anxious. Now this patient problem that runs through all care plans. Every patient in the hospital is anxious about the surgery, anxious about the medical condition. Let's say this condition is going to kill me, and it runs through their minds every now and then. So this is one problem that runs through every patient. So bear in mind, you can write it everywhere in addition to the inadequate knowledge. So these two problems, you can always write it somewhere, because the patient is likely to have inadequate knowledge about disease condition, but not always. Some people have more knowledge, like in-depth knowledge, even more than you, the nurse. Okay, so the inadequate knowledge is not always, but then the anxiety, it's almost certain. Okay. So let's move on to patient is anxious. Now, what can we do, or what can the patient do, or what does the patient have to help with this problem? So let's say now the patient is willing. The patient is willing to cooperate with the medical team So patient is willing to cooperate with the medical team to help with speedy recovery. Okay, so this, if we are able to do this, the patient's anxiety levels will reduce. Okay. Now the last one, patient has inadequate knowledge about disease condition. So we can also write patient is willing to learn more about the disease condition. So to learn more about the disease condition. Okay, so just as I told you, we use the patient's problems to write your patient's strengths. And the patient's strengths is just about what the patient can do, what the patient has, etc. Okay, now let's move here. Routine care. So here we have CPR, which is basically temperature pulse respiration. Okay, so the normal routine checking of the temperature pulse respiration is 4 hourly, but then it depends on the patient. Okay, so it depends. Maybe some patients, theirs are monitored 1 hourly, especially those who we are doing a blood transfusion for. So theirs maybe 30 minutes or 1 hourly. Okay, so it depends on the patient. So we are doing the normal here. So you write monitored 4 hourly, and recorded. So monitoring, we also record. So same applies to the blood pressure, monitored 4 hourly and recorded. Okay, the diet. So let's say the patient is on a normal diet. Okay, so let's write normal, but then there are various forms of diet. Okay, so the normal diet is the normal food that we eat. Okay, or maybe the patient is on a fluid diet or a light diet. So it depends on what diet the patient is on. So basically, for those who have undergone surgery, they mostly are placed on light diet. So foods that are not that heavy. Okay, so we have normal diets, light diet, etc. Okay, so fluids. So normally we place liberal fluids here. Okay, liberal fluids. Now intake and output. Okay, we have a chart known as the intake and output chart. Okay, now if the patient has a catheter in situ, it means we are probably monitoring the intake and output. So here you just write intake and outputs monitored. Okay, then oral hygiene. Okay, done twice daily with toothbrush and toothpaste. It depends on how often the patient does it, so you just go with what the patient tells you. So let's say the patient says it's done once daily with a toothbrush and a toothpaste. Okay, and back then too, you just go with what the patient tells you. So that one, so you write done once daily with, let's say, towel, Dettol, and water. Okay, now urine testing. Okay, so you can check this from the folder. So if they did any urinary for the patient. Okay, so if it was done, you write. So done on admission. Body weight is also written in the folder. Okay, so let's say here's 59 kilogram. And activity, so here it depends on whether the patient is on bed or always in bed, or the patient can move about. Okay, so if the patient is always in bed, you write patient is bedridden. But then if you observe that the patient can move about willingly about his normal duties, you can write ambulant. Now bedridden can also you can also write passive. So the activity is let's say passive, not really bedridden, but then he can do certain things. So passive form of activity. So it could either be bedridden, like always in bed, can't do anything. Ambulance, can get up and walk. passive, can turn around in the bed a little bit, can stretch hands, etc. So that's what you do. And moving on to our next phase of the nursing care plan, which is your diagnosis, our objectives, nursing orders, interventions, and evaluation. It entails a lot because if you're able to do all this correctly, you get 12 marks. Okay, let's move right into it. So we have here date and time, nursing diagnosis, objectives, outcome criteria, nursing orders, nursing interventions, and evaluation. Now, for the purpose of examination sake, we normally limit students to write 3 diagnoses, 3 nursing diagnoses. So when you get to the exam tool, you divide this part into 3. So 1, 2, and 3. Okay. Now, this is what you're going to do. Your nursing diagnosis, you gain that or you get that from this place, the patient's problems. So we use the patient problems to write your nursing diagnosis. Okay, so you select any 3 of these. So you select 3 of these problems and use it to write your nursing diagnosis. Okay, let's move straight into it. So date and time. So let's say we are still on 12 April. So 12 April 21, and the time. So at, let's say, 10:30 a.m. Okay. Another date and time. The same 12/04/21, and let's say at 11:50 a.m. The last one, let's move on. 12/04/21, let's say at 2. Okay, at 2 p.m. Okay, now let's look at how to get our nursing diagnosis. And just as I told you, we use the NANDA nursing diagnosis here in Ghana. Okay, and these are a couple of them. So we have some NANDA diagnosis here. We have risk for infection, hyperthermia, hypothermia, acute pain, so these are some of the nursing diagnoses here. We have risk for infection. So let's say the patient has a wound and there's a likelihood for an infection to occur. Hypothermia, when the patient's temperature is low. Hyperthermia, when the patient's temperature is high. Acute pain, when there is pain, when the patient complains of pain. Chronic pain, labor pain. And when the patient is anxious, you can choose anxiety, death anxiety, etc. When the patient has little knowledge about the condition, you choose this diagnosis, deficient knowledge. If the patient can't sleep, you choose insomnia, disturbed sleep pattern, or sleep deprivation. So these are a few examples of NANDA nursing diagnosis, and I've already given this out in the first video, okay, at the description box. Do well to download it. Okay, now let's move straight into what we need in our care plan for this patient, Mr. Michael Owusu. Okay, so let's head straight into it. So our first problem for Mr. Owusu was about he complaining of pain in the abdomen. Now we already know some nursing diagnosis for pain. Okay, so you move on and you ask Mr. Owusu whether the pain has been there for a longer period of time or a shorter period of time. So if it's a longer period of time, you write chronic pain. If it's a shorter period of time, you write acute pain. So let's go with acute pain. Now this is the nursing diagnosis, and whenever you write a nursing diagnosis, you relate it to a process happening in the body or outside the body. So this is how we go with it. Let me just go straight ahead and relate it to something. So acute pain related to inflammatory process of the disease condition. Okay, so that's the nursing diagnosis. Now, most of the time, pain is due to an inflammatory process. We all know of or if you don't know, there is this prostaglandin synthesis pathway, and it's in response to an inflammation going on, and it's normally leads to pain. Okay, so but then if it's not due to this inflammatory process, maybe there is a visible wound, so maybe acute pain related to the wound, or maybe there's a surgical incision. So maybe he undergone a surgery and there's this incision there. Maybe there's pain from that side too. So you can relate it to that. Maybe acute pain related to surgical process or surgical incision. I hope you get me. Now I left something here. Acute pain, you can add something here. Abdominal pain. So to be precise. Okay. Now related to inflammatory process. Okay, now let's move on to the other ones. He also complains of sleepless nights and also anxiety and also inadequate knowledge about disease condition. Okay, so with sleepless nights, I can choose insomnia, just as I show you. So we have insomnia, disturbed sleep pattern, etc. So let me go with insomnia. Related to unfamiliar hospital environment. Okay, I don't know about you, but this mostly happens to me. Whenever I go to a new place, I find it very difficult to sleep. Yeah, so my eyes will be just open throughout the whole night. Okay, so it happens. But then maybe Mr. Michael here can tell you the reason why he can't sleep. So you relate it to that reason. Okay, now let's move on. The last one is the patient is anxious. So there is this anxiety and also inadequate knowledge about disease condition. Okay, so you can choose any of them. So for me, I want to choose inadequate knowledge. So let's move on to the nursing diagnosis, which is deficient knowledge. So you relate it to something related to inadequate information about the causes, prevention, effects, and prognosis of the disease condition. Okay, so this one too, you find out from the patient, and some people, maybe the deficient knowledge or the inadequate knowledge stems from, let's say, a superstitious belief. So you just write inadequate, deficient knowledge related to inadequate information, maybe into brackets, superstition, etc. I hope you get me. So here, Mr. Owusu has little knowledge because he has inadequate information about the causes, the prevention, the effects, and prognosis of the disease condition. So we are done with these three nursing diagnoses. Now we're moving on to objectives and outcome criteria. Okay, so let's move on with the objectives and outcome criteria. Now, before you set your objectives, it has to follow this mnemonic here, the SMART objectives. Okay, now it has to be specific. Your objective has to be specific and well defined. Your objective has to be measurable. That's, we can use certain metrics to measure the patient's progress. It has to be achievable. So whatever you are saying in the objective, it has to be achievable. Okay, it has also to be realistic. It has to be very relevant. You can't just be saying anything. Okay, and lastly, it's time bound. So you don't have the whole day for one patient. So you have to set a time, a start and an end time for this goal. Now we all know objectives, what we intend to achieve at the end of these plans, at the end of these cares that we are going to give to the patient. Okay, now let's move straight into how to write your objectives. Okay, so since it has to be time bound, okay, let's head straight into it. So after 40 minutes, patient's abdominal pain, patient's abdominal pain will reduce by a scale of 1 as evidenced by patient verbalizing that abdominal pain has reduced a little, and 2, nurse assessing patients. So nurse assessing patients' level of pain and realizing level of pain and realizing it has reduced by a scale of 1. Okay. Using a pain scale of 1 to 10. Using a pain scale of 1 to 10. Okay. So this a complete objective or outcome criteria. Now you notice that after 40 minutes means it's time bound, and I was specific here relating to the patient's particular need, pressing need, abdominal pain. Okay, and I was also specific here that it will reduce by a scale of 1. Now I know that after everything the pain will not just subside, so that makes it less realistic. So I'm trying to be realistic here. So it should at least reduce by a scale of 1. Now we have these ones too that are very important. The evidence. So we need an evidence. So as evidence by patient telling you or verbalizing that the pain has reduced a little. And now the nurse too has a role to play here. So the nurse can assess the patient's level of pain and realizing that it has reduced by a scale of 1, using a pain scale of 1 to 10. So this is how you go about writing your objectives. Okay, so it has to be time bound. So mostly I use 40 minutes, 30 minutes. You can't spend the whole shift, the whole 8 hours on one patient. What will happen to the other patients? So you just need to structure your time well. So you do same for the rest here. So I'll just dive straight ahead into that one. If you get this one, yeah, it's very easy. Okay. So insomnia. So let's say Okay, so this is the next one. That's actually related to insomnia. That's lack of sleep. Okay, so after 40 minutes, patients will be able to sleep comfortably, as evidenced by the patient telling you that he slept well, and also the nurse observing patients comfortably sleeping in bed. Okay. The last one, deficient knowledge. So let me go straight into it. So let's take after 30 minutes. After 30 minutes, okay. Patient will be educated on the causes, prevention, effects, and prognosis of disease. As evidenced by 1. Patient answering about 70% of questions asked. Correctly. II. Nurse assessing patient's level of understanding. So this is it. We are done with our 3 objectives as well. So the last one, after 30 minutes, the patient will be educated on the causes, prevention, effects, and prognosis of the disease condition, as evidenced by the patient answering about 70% of the questions asked correctly, and the nurse assessing patient's level of understanding. Now get this here. After everything, there has to be an evidence, and the patient and the nurse should play a role. So you don't just write only the nurse playing a role. Okay, so the patient must have something to do about the objectives. So you write the as evidenced by the patient doing something and the nurse also doing something. Okay, so mostly the patient can say something, so verbalize something to you, and then the nurse can also observe something, so you can use observation, assess something, ask something, etc. Hope you get me. Okay, so guys, this is where we end for the first part of this video. We'll continue with nursing orders, interventions, and evaluation, and we are set, and you'll be able to write a care plan with ease. Thanks for watching.